Are you curious to know that not all pain has a structural basis? There could be some pain which has an emotional aspect to it, learned behaviors, and several other causes which are otherwise unknown to us. So if you have been dealing with chronic pain in any part of your body, then this session is for you. It's an interesting session for which we have our guest Dr. Varsha Kurhade, and all the information that we are going to get today comes from a very, very highly experienced doctor who is an MBBS and MD and a pain medicine specialist. She has been practicing for over 15 years and also runs fellowships, courses and training for people who are now doctors who are going to be now inducted as pain medicine doctors. So welcome, Varsha.
Thank you.
So let's dive straight into the topic. So tell a little bit about what is chronic pain.
Right.
What do you mean by it, and as per your experience, what have you seen in patients?
Right. So chronic pain, if you start with distinguishing the types of pain, when you say chronic pain, there is acute pain. Acute pain means the origin of pain is since few days, say 3 days, 5 days or 7 days. And any pain which lasts more than 3 months duration is called as chronic pain. And as you know, we all are going through acute pain a lot more, always. There could be simple reason like scratch or some foot sprain, twisting injury, little bit fall, something like that. Those are acute pains and they have some structural damage, as you rightly said. And they are treated with medicines. These patients go to their respective specialty and they are treated and they are taken care very well with faster recovery. Coming to chronic pain. Now these are the pains which lasts for more than 3 months. Minimum duration to label any condition chronic pain is 3 months. So just like your headaches, migraines, joint pains, pains related to your neck or back originating from your spine, leg pain, foot pain, ankle or heel pain, they are all chronic pains. Okay. So that's what is the gross difference between acute pain and chronic pain.
So what happens really in chronic pain? We were talking about how, sometimes the body is it becomes very sensitive to pain. Can you tell a little bit about that aspect of pain? And your experience with the patients?
Right. So as you rightly pointed out, chronicity itself implements that pain has exceeded from the level of recovery to your mind. Maybe, for example, I have sustained some foot injury, twisting of leg while walking or climbing the steps, and there was a swelling. I took some medicines, some rest, braces, and say 2-3 weeks, swelling has disappeared. I'm walking comfortably, apart from minor aches in between. Now, given this one scenario, same types of injury, one patient, 3 weeks, 4 weeks, with all the medicine protocol, injury healed, and patient is back to normal lifestyle. Okay, cut to second patient. Injury healed, if you get x-ray or other investigation done, structurally it's absolutely fine. But patient is experiencing pain. Patient can walk, patient can do all daily stuff. All investigations are normal, blood tests are normal. But this patient is experiencing pain and there is no evidence of any damage. By no means relatives or doctors can explain why this pain is there. And this is the time pain has started proceeding towards chronicity, which has connection directly with your brains. There are circuits. It's not kind of a ghost pain. For people, they understand it as ghost pain because everything is normal. But now the circuits in your brain or signal carrying pathways in your body have started developing sensitivity, and these pains start becoming chronic pain only because the message which goes from foot to your brain, it's constantly telling there is a pain, there is a risk, there is a pain, there is a risk. So even if you are walking on a normal road, just because some commentary is going on in your head, be careful, be watchful, there is a pain, you had hurt your foot, now be careful, and you become anxious about it. And rather than focusing on, okay, there is a road, I am walking, I am going to XYZ place, may it be work, may it be mall, your brain is constantly making you focus on the foot injury pain. Foot injury pain, that is called as vicious cycle. It drags you to that thought, and that cycle sets in. So all the time, we say na, all the time something is sitting on your head. Are you mad? That's what relatives say. Your tests are normal, everything is good.
Right.
We have got best footwear. And still it's hurting. What is it? Why are you thinking so much?
Correct.
So that is the chronicity of pain.
So when everybody else knows that there is really nothing wrong, for that patient it has become the center of the focal point of their lives.
Absolutely,
right?
absolutely.
And that is not easy to solve, I'm sure.
Yes.
So how do you go about dealing with that kind of a patient for whom there is, like, that has become their world?
Correct. And that's where comes the role of multimodal pain management. So this is very good question, by the way. I would love to answer this, as till say last decade, as far as pain understanding went, there were two separate categories, distinct. All patients coming to doctors, if there is something abnormal in say X-ray, MRI or medical investigation, it will be treated, and rest of the patients will be diverted directly to psychiatry. Because there is nothing visible, there is no structural damage. So that was the only way available. Okay, now go for counseling. And then psychiatry department has their own set of medicines and diagnosis. So that was the development in medical field. And then these patients would end up getting psychiatric medicines for little prolonged duration. Yes, it helps initially because, as I said, it involves the component of mind. But again, that doesn't help in long run. And eventually they would end up either with the side effects of psychiatric medicine or them stopping the medicine, and the misery of them suffering continues. And they will be upset, they will be depressed, they stop sharing their pains, they stop complaining because no one is listening.
Right.
For everyone else who are busy in their day-to-day schedule work, for them it's roj ka rona. They conveniently neglect, and then patients also stop speaking about it, and that puts them even into the worst condition, with the emotional aspect getting deeper. So already there is some pain which started as a physical pain that is hurting, along with few areas of your brain which are involved in emotional or psychological pain cycles. Now they have become more sensitive.
That's very interesting, actually, what you're saying, that a person may be having pain in any part of the body.
Correct.
Right? But that person is receiving psychiatric treatment and it is showing results, even if it is just for a little time. That means it has to do, like, that really proves that something to do with psychology is involved over there, and that's again not a long-term solution. But
yeah, and exactly that's the point where it gave us a clue or hint towards having psychosomatic components for chronic pain. So now, as I said, this was the scenario say a decade or two earlier. Now we have developed this specialty called pain medicine, where along with doctors there is equal involvement or role play by other specialties like physiatrist, psychologist, who is not a doctor,
right,
pain nurse, counselor. So looking at this spectrum, and some places caregiver, like patients' relatives, the one who stays with them. So now if you listen to this team, there is only one doctor like me, called pain medicine specialist, plus 5 other specialists. That itself speaks about how chronic pain needs to be addressed in a multimodal way, and not just focusing on medical way and giving tablets. And that's where the psychological or emotional components, it's addressed very powerfully. Though I am a doctor, patients' psychological counseling starts right in my OPD. And as I start interacting with them, they come up with their stories or fears around the pain.
Like, I would be very interested.
Exactly.
To know. What can you tell us a story that has stood out for you? And
So 2 days back only, I had a patient who had undergone hip surgery in one hip, and now she is here for another hip pain. She's 85-year-old, very elderly, fragile lady, and obviously now they don't want to operate. She's here only for pain management. And I started with the treatment. Treatment is very good. She got pain relief, and 2 weeks later she's again coming up with the pain. Now I am clear that my treatment was flawless. She experienced pain relief, but she could not sleep on her back. She spent last night just sitting in a chair. That's how she slept.
My God.
So she was not able to turn or sleep on the back. That's what their concern was. And as she was fragile, she had sustained fracture in the next hip. She gave history of fall 2 days back, and she sustained a fracture. So the moment I examined her hip and ordered X-ray, I got to see there was a fracture. And the moment I explained relatives, because of fracture she is not able to sleep, actually that diagnosis made them understand the reason versus the anxiety they had in the last operation. Some complication had happened, and they thought if it is the same complication happened in this treatment. So they have their own set of thoughts, which is absolutely right in their place. They have experienced something. It's a part and parcel of the procedure. But that threat was there since 5 years. And now they speaking to me about that threat. This happened in the 3rd visit. It doesn't come out in the 1st visit. But somehow in the 3rd visit they mentioned that, ma'am, because this has happened 5 years ago, we thought even this time if that hip is suffering from that complication. And when I said no, it's a different condition, it's a fracture. Though fracture is a big thing, but they were okay listening to it. It's a fracture and no other complication. Now we are focusing on the treatment of fracture, rather than they getting distracted with different thoughts. So they had a fear like, could it be cancer? Could it be some blood related issues? Or could it be progression towards paralysis, which will make her bedbound permanently? So these are the unspoken fears.
So what you're trying to say is that sometimes the root cause is not, like, it can come out only when you talk to the patients, try to understand what they've been going through or what has been the past, their beliefs and all of that. That kind of influences how that lady, for example, experienced pain now. So does that mean that once she knew that there was fracture, her pain or experience of pain reduced to some extent, or what really happened?
Her experience of pain was still the same, but the way she responded, oh, is it the fracture and not that particular XYZ condition, it altered the expressions on her face. And now she knows that yes, I am suffering from this. So the moment they focus on actual condition and their mind is not wandering around, it helps them also to comply with the treatment. And the more they comply with the treatment, they are going to go faster towards their recovery. So this is what exactly happened with her. And as you all know, no doctor can spend so much time in their busy OPDs and all. Though in pain medicine, we spend almost 20-25 minutes, which doesn't happen in other specialties. And that's where we need the team of specialists who are addressing them physically, like physiotherapists or counselors.
What kind of, so when say a patient is coming to you, what are the things, or rather, let's not say coming to you, but there is somebody out there who is watching this video and they are in some kind of pain. What would you recommend them from the point of view of looking at their beliefs or something that has happened in the past that is now kind of driving what doctors they meet, or driving whatever decisions they take about their pain or their experience of pain itself?
Yeah. So it's a very common observation in our OPD. The moment patient enters, see, hospital is not a place where it's a voluntary entry, right? So till the time they are suffering badly and it really makes their routine life troublesome, they don't come to the doctor. Okay, in place like India, you get home remedies and over-the-counter medicine. Yes.
Okay.
By the time they reach doctor, the pain has already crossed their 50 to 60% of threshold.
Yeah.
And now is the time for intervention. By intervention, I don't mean surgery or hi-fi intervention. It could be as simple as counseling or the therapies which our psychologists do. And as I said, it starts in my OPD. So the patients come up with the fear, oh, if I go with spine problem, knee problem, doctor will advise me surgery. Because few months back, I went with my cousin, uncle from the distant family, and he had similar problem. He also had painful knee and clicking sound, and he was advised surgery. And after surgery, he started limping, and he's not able to squat or climb faster. So for me also, if doctor advises this, I will end up with the same outcome. Honestly speaking, even if condition is the same, every person, even if they are identical twins born from same mother and same genetic makeup, the condition, the experience they get is different and treatment is different. So first of all, you should understand that you should reach out for help and not just get scared by some other person's experience, because that person is different, his working environment is different, his body makeup is different, the reaction to pain is different. If some cockroach sits here now on my shoulder, I will be scared, shouting around, running around. But for you, that cockroach is just like some little object, and you will just throw it like this. So this is how same thing happens for chronic pain. It is shaped by your past experiences, the environment from which you are groomed up, and how you perceive pain as a threat. Or actually, I tell my patients, it's a good sign. Pain is a warning signal that please pay attention to your body. Pain is first sign for which patient comes to doctor. So it's a warning signal, and take it as a positive sign so you can catch your problems earlier stage rather than getting complicated. So the message you asked me, what I want to give to listeners is, whenever you are suffering from any types of pains, and you have visited primarily few doctors, and now it has been more than weeks or months, it's the time to visit experts, and they will guide you through from whom you can get help. You don't know sitting at home whether it is structural damage, whether you just need few medicines or physiotherapy, or they will listen to you and just teach you some mechanisms like pain reprocessing therapy or cognitive behavioral therapy or coping strategies or positive feedback mechanism. These are simple counseling therapies. Distraction therapy, just like I gave the example, you focusing on foot pain trauma, and then there is a distraction. So there are very simple therapies which can really make you get rid of your chronic sufferings. And by the way, I have yet not spoken about the systemic effects of pain.
Yeah.
That will come in our second session.
Super.
So it just does not affect your pain quality, but it has a huge impact on all your other body systems.
Okay.
Like diabetes, hypertension, thyroid, even heart issues. This much your chronic pain can worsen your life. So address
it's
it,
really
attend to it.
something
Absolutely.
which the body is trying to say that it's not, you should not ignore. And maybe people who don't have that a warning sign, for them it should be a problem, but those who have it should actually make it like a blessing for them.
Absolutely.
Right?
And this is something new perspective you are giving. I like that the turn around you said about pain, warning signal. That okay, now get up and go to the expert, whomever you start to seeing.
Right. Just one thing, like going back to our discussion where you said that there is, like, people come in for pain, and then sometimes you figure out it is the psychological aspect and send them to psychiatrist, and then medicines don't work. So obviously the pain, now this is when the pain started, right? But let's go backwards and see that when the pain was not there,
right,
but the person was landing in that situation where the pain at some point came. What really happened before that pain that got them into the pain? If it is really psychological therapy that is working, even if it's for some time, right? Medications in any form you don't want to continue for lifelong. So what really got them into that state where it became like a psychological thing?
Yeah. So again, there is a fine line between what you are trying to ask. Let me ask
one more
you.
thing before.
Yeah.
Like, I remember one patient you had told me some time back that this patient, she had some pain, and then when you kind of understood what is going on, you discovered that this lady has her son in her 10th exam, and she was quite stressed out, and then you kind of counseled her out of it, and really she got fantastic results. So, like, connecting that story, if you can
exactly
tell a
so
little
this
bit.
is the part we are coming to. Getting overwhelmed by different things going around in your world and mixing it with your pain. So yes, there is pain, you are experiencing pain, and there comes fear or anxiety along with pain. So patient is coming with pain, she is not able to get up from bed very easily, and her son has to go early morning for the 10th classes. Exam is due in 2 months, and along with her back pain which has started showing up, her husband works most of the time, like 20 days out of the state, and she is alone to manage household things plus taking care of her son who is appearing for the board exams, which is critical for his life. So now this is how every pain is attached with a small story. And when you start asking patient more than pain, what scares her is, what if next day I am not able to get up from bed and feed my son, and my husband is not around, if my son goes to class, if I am not able to get up, who will bring me to the doctor? And who will feed my son? And what if permanently I don't get out of the bed? And again, as I said, unspoken question is it going to take me towards the end of my life? It's very scary. You don't speak it out, but this is constantly going in your mind subconsciously. And all your pains get aggravated by these stories attached to your pain experience. And the only fact behind this is what is coming to you from surrounding. Lot of exposure to Google Media, YouTube, and then people telling that XYZ person had backache similar to you. Here is the hitch. They just casually say, oh, some XYZ also had backache similar to you, and it was diagnosed as, say, cancer or some miserable condition, and then that person never came out of that disease. And this is what is the specialty of human brain. It captures the stories which are negative very quickly then the stories which are positive and they will empower you. Because positive story will just go like, if I ask you, Aarti, oh, you said your Nani had some surgery last week, how is she? You will say, oh, superb, she's undergoing physiotherapy, she's out on her feet and going around. And in 2 sentences our discussion will end, right? That will not register on my mind. But if you say, oh, surgery was good, Varsha, but 2 days later she had fever, she was in hospital for 10 days, we were managing ICU, now she's home, little better, Now you have a story which goes for say 5 to 10 minutes and this story gets registered. So you will hear out of 10, 8 success stories you will hear, but they will be vanished quickly from your memory.
Just one.
But 1 or 2 stories, they will stay here forever. Right. And they will keep feeding to your pain and to your fear. And they are from past. Actually, they have nothing to do with your body, your condition and your treatment. But they will constantly nag you.
Right.
And make you so fearful, scared that your pain gets aggravated. Like I said, emotional centers in your brain are connected with your these physical pathways. So it is just like that, one getting ignited with other and then they combine and they start attacking your body together. And that's how physical pains, even without structural damage, they will take you towards this vicious cycle.
So a couple of interesting points that you raised. One is of course that what situation they are in currently.
Exactly.
So even if there is pain, is there other stressful things that are happening in their life? And how much, not just working, of course that is important, where you go to your doctor, understand the diagnosis and stuff like that.
Yeah.
But also going beyond that and not like working on your anxiety of whatever is happening in your life. That is one aspect to it. Second is where you are talking about how whatever you are hearing from outside about failed treatments, which become the highlight of the story that is getting fed into your system, and then you making decisions out of those whatever has been registered in your system. True. Then becomes like a roadblock for your recovery.
Absolutely.
Right?
Yeah.
So that's a wonderful point. Varsha, can you summarize your message to the audience?
Right.
What they should be taking care of from this conversation, what really you can bring together?
Yeah. So the most important thing, first of all, your body is unique. You have to take care whatever it takes. And there is a signal, something is wrong. You are the best person in the world to know if something is going wrong. No doctor or no expert ever can know that better than you at first point. So it is about you reaching out for help at the earliest. And then there will be experts, they will be guiding you. Secondly, never ever compare your body or your condition based on stories heard, your past experiences, or whatever information is easily accessible on social media.
Yeah.
Okay. So, third and most important point, share. Whatever is your experience, your pain, talk to people around you, your relatives, your friend. That will give you the access to reach out to where it is actually required. Okay, don't sit with pains.
But what happens when, I'm sorry to cut you here, but I find it quite interesting because I have had pain for a good 10 years of my life, and at some point it was shameful for me to be talking about my pain, and because I didn't feel that people can really understand what I'm going through, and it was also because I was not in the age where you would expect somebody to be in pain. So how, when you're saying share with people, don't you think it is not really practically possible, or why do you say that despite that share with people?
So that's what the whole point is. There will be always someone in your life whom you trust and who trusts you. there will be people around you. It is just that you don't see. When you are in that shell or cocoon, you shut yourself. It's my suffering. What is the point of telling others? Anyways, it's my body. I have to bear with it. What is the point in telling? And that's the exact point I want you all to get. Break the barrier. Communicate. You will have few people in life with whom you can share anything, right? It cannot happen that you don't have a single person who understands you, who get your emotions, who supports you in your thin and thicks.
Yes.
Absolutely. These are the people around you. Identify, talk to them, and they will really be there available to support you. Because exactly these are the times you need support. You are absolutely not in your mind to take judicious decision for yourself. And these are the people who will play that role for you.
Wow.
Trust them. They are around you.
So basically get a support system around you which
that's very important.
Which can really hold that space.
And that's what explains the role of psychology and emotions in chronic pain.
Yeah. Right. So this becomes a part of therapy where you actually like treat it like a treatment.
Absolutely.
Rather than saying that
we always say we pull the family in the discussion. We ask their relatives also to come along and let them also understand the process and not just label he's bluffing around and there is no real pain or she is just making it. Correct. It's not real pain. She's avoiding work. That doesn't happen. So you pull the whole family or caregivers into this.
Right.
That's how it goes. And it helps in a long way.
Wow.
Right.
Fantastic. Thank you so much, Varsha, for this beautiful, sharing of all the insights from your own journey of practicing and working with these patients who have chronic pain. It's really nice, and thank you so much for your time.
Thank you everyone for listening, and thanks a lot for inviting me and making this session so interesting.
Thank you.
Thank you.